So I'd like to start by sharing with you a short story to kind of set the tone on how I'm using RFA or the Osstell technology to help guide the way we practice on a day-to-day basis. And so this is a patient who is a trial lawyer. Of course, the most challenging patients are always attorneys, and in need of extraction of his maxillary left canine due to root resorption, and he is absolutely adamant not to have a removable temporary prosthesis. And we extract this tooth knowing from our cone beam that we're going to be engaging palatal bone, which means for me that we're going to use an implant with a subcrestal angle correction so we can achieve screw retention through the cingulum today. And so the implant is placed. We take our ISQ reading after knowing that it went in with only 20 Newton centimeters, and I say only in parentheses, and we will certainly focus on insertion torque. And we have relatively low ISQ values of 46, both from the facial and the palatal. And so this makes me a little bit apprehensive, not so much because of the insertion torque, but because the ISQ is rather low. And this patient, as I said, is absolutely demanding immediate temporization. And so I took a surgical impression. The patient went to his restorative dentist right down the road, and I tried to convince the dentist to convince this patient not to allow us to immediately temporize this implant. But the patient insisted. The dentist was very skillful at keeping this restoration out of occlusal contact, and we had good compliance from the patient. So at 8 weeks, I need to find out if we're moving in the right direction. So I removed the temporary. It is painlessly removed from the patient's mouth. There's no rotation, but we only get an increase of 2 ISQ values, which for me starts to get my anxiety going a little bit. Where are we going to have success, or are we just prolonging a failure here?